could it not be argued that these reforms are a continuation of the new Labour reforms? I mean, Mr. Blair, in his memoir, said we just didn't go far and fast enough on health reform.
Yeah, and fast enough is the key word, actually, because this has been done with indecent haste. It didn't figure in the manifesto. Now they're saying they've worked 20 years on it, so where was it in the manifesto? I think the haste with which it's being carried out, the scale of the operation, and combined with the squeezing of funds, I think could completely destabilise and undermine the NHS. And these are staff working to implement these reforms who are on pay freezes, most of them, and the morale is low.
Is it really that radical, Jacqui, or is it evolutionary?
Well, I think there are elements of it that are evolutionary and that actually I would support. I mean, I think extending the idea of giving patients more control and choice into areas where it didn't exist before.
I don't think patients want that, Jacqui. And I don't think there is any such thing as choice in public service. My son goes to his 5th choice comprehensive school. Where was the choice there? There was a selective school.
But you care about whether or not you had a choice there, don't you, Fiona?
I'd rather know it was a good local school that anyone could go to.
Keep to the health service.
I do, but also I think actually people do care about having a bit of control over their health in partnership with their GPs. Now, where I think Fiona is absolutely right is this top-down reorganisation, which actually not only was not in the manifesto, but there was a promise that there weren't going to be any more top-down reorganisations. That, I think, is where potentially these reforms are going to run into big difficulties, because I can't see how this does remove bureaucracy if what you're asking is relatively unprepared GPs to take on commissioning. What they're going to do is they're going to take on the staff from the PCTs, unless the good ones... The primary care trust, sorry, unless the good ones have already gone somewhere else.
Michael, they didn't tell us about this before the election. They certainly didn't spell it out. There are vague words in the manifesto, but they give you no inkling of the radical nature of this reform. So why is Mr. Cameron and the Tories, why are they doing it?
I mean, because they believe in it.
So why didn't they tell us?
Because they didn't believe they could win an election if they told you what they were going to do, because people are so wedded to the National Health Service. It's the nearest we've got to a national religion. It's a kind of national sacred cow.
So the Tory position was the health service is safe in our hands, and we're just not going to tell you we're going to
change it,
blow it up and start again.
Change it completely. I mean, you see, Fiona's assertion in her film is what I fundamentally disagree with. She says, with competition, there's always a loser. I'm not aware that that is true. I mean, when I take a plane, when I buy a mobile phone, when I go shopping for food, I'm not aware of any losers where there's competition. What is perfectly clear to me is that where there isn't competition, there are losers. And I can see that in the National Health Service, the absolute lack of competition has allowed the most enormous bureaucracy to become established, layers and layers of management, incredible demoralisation of consultants, lack of training and leadership in the nursing staff. Something's got to change. And the best formula we have
waiting lists down, standards up, patient satisfaction
for the amount of money that was spent, really poor results. If they spent 100, they got a result of 10. Incredible inefficiency in the National Health Service.
Waiting lists are already going up in the few months that the Tories have been in control.
Well, none of these reforms have started yet. I really think there's just so much.
Well, they've got rid of targets already.
There's so much better a chance. And by the way, this is evolutionary from Labour. I mean, you talk.
But I don't agree with that whole choice thing. So I didn't agree with what Blair was doing.
For instance,
actually,
Julian Legrand, who was Blair's advisor, says that this is evolutionary. This is what Blair wanted to do, what Blair would have done, what Blair would have done if it hadn't been for Brown.
Doesn't mean it's
on
best.
this choice, they can answer. You don't think we should choose our doctor?
Yeah, we should be able to. No, do you know what I would like? A situation where you know your local doctor is going to be good, where you know your local hospital is going to be good.
The only way the doctor can be good is if we have the power to choose the good doctor against the bad doctor. You don't think we should have the right to choose our hospital? You think it should be Soviet style? The bureaucrats tell you which hospital to go to? I
think people are so busy and so... I mean, I come from a family whose mother dressed me up and did my hair to go to the doctor, and that's how, doctor was God in our house. And I think these changes now, where GPs are in league with the private sector, and you have a pound sign over your head as you walk in the surgery...
I'm just worried of the choice issue, because in Moscow you had no choice of supermarket, and I don't know if you've ever been to a Soviet supermarket.
Well, I don't think you can...
No, I don't
having argued for choice, I don't think you can necessirily then say
you choose to go to a supermarket.
You have to buy food, Jacqui.
A structured NHS is Stalinist. I mean, I think it is possible in the way in which I think is part of these reforms, to introduce some more choice, which I would support. But, you know, I just go back to this point that where I think, and incidentally, one of the reasons I think why the NHS wasn't a big issue in the election, actually, wasn't only the reason that Michael gave, it was also because effectively it had been neutralised by the success of the reforms, the high level of satisfaction that there was.
Which the Tories told us they were just back.
Tories, exactly. So I do think that there is a potential unravelling from a massive reorganisation at a time when you're also expecting and asking people to make
Michael,
big efficiencies.
can I just ask you the politics of this? You see, I think Jacqui's right. The NHS was neutralised because the Tories, Mr Cameron went out of his way to say the NHS is safe in my hands. I've had to use it myself for my young son, and we're going to spend at least as much as Labour did on the NHS. Never told us anything about what he's now planning to do. Doesn't that damage or have the risk of undermining the Tory positive ratings they were getting on the NHS?
Yeah, no, this whole thing is risky. And it could be that it will turn out as Fiona says. I don't think it will, but, you know, the whole thing could go badly wrong. The reason it's rushed, of course, is that it's all got to be done within 5 years.
It's to do with ideology, not patient outcomes.
No,
That's why it's been rushed.
Well,
they couldn't wait to do it.
It's to do with...
Would you like to let one of these two just...
Sorry, I'm getting overexcited.
It's to do with it's to do with a political idea, which simply means that they have an idea of how things work. And they believe exactly the opposite of what you believe. They believe that no competition is what leads to losers, not competition leading to... But may I just make one point, which I think is fairly important. I think the GP fund holding is not the big issue. I think what will happen there is, you're quite right, the same civil servants will come over from the primary care trust and they'll do it for the doctors. The really big change is that all hospitals are going to be trusts and lots of them are going to be really independent.
I mean, that's what Mr Blair wanted to do.
Well, the interesting point is, I think the reason why it's rushed is because actually David Cameron is looking at Tony Blair's view of us not moving quickly enough in the early years.
And the Camerons are obsessed with that, Jacqui.
Well, they are, but the point is, you know, reform is not an end in itself. You have to be clear about what it is that you actually want to come out at the end. And I get a feeling about these health reforms that actually it isn't clear what the end point is. It isn't clear either that those things that have been improved over the last 15 years are going to be safeguarded as we go forward.
But it's what you as a Blairite wanted. I mean, Mr Miliband wanted the foundation, all the hospitals to be foundation trusts. Mr Blair wanted it as well. You wanted it.
Mr Milburn.
Mr Milburn and
Alan
Mandelson.
Milburn, a former health secretary, believed that no unit in the NHS should be bigger than a county. And, you know, that's where we're headed.
Well,
do you know what I think is fundamental to this whole thing? And I do think the GP commissioning element is really, really crucial, because I think the trust between patient and doctor is going to be broken. I will no longer have the same respect for my GP when I know he or she is in league with a private company and that he's looking at me with a pound sign hanging over my head every time I go in there. I really do.
And also, they're going to be on... Why do you think he'll do that?
Well, because they're on quality premiums, i.e. bonuses for performances, and I don't think that's for patient outcome.
What's happened to GP pay under Labour? I mean, where do you think all that money
Apparently
went?
it's going up again. There's talk of it going up again once this new system is in place.
But if you're worried about your GP making too much money, you should have been worried for the last decade, not now.
And I'm worried about my GP earning too much money in league with the private sector, and the fact that that's going to encroach on the NHS.
Well, I'm afraid that's yesterday's story as well as tomorrow's.
Sounds, Jacqui, that the NHS could be another big issue come the election campaign.
Oh, Michael is absolutely right that this is something that people care passionately about.
The way it wasn't in last year.
It wasn't in the general election. But
it used to be, of course.
It did used to be. I mean, you know, one of my very good friends, David Locke, you know, who I shared an office with when I was first elected as MP, lost his seat in 2001 precisely because of the closure of a hospital. You know, this is something that people care passionately about.
It is historically brave because Labour has had the advantage on the NHS since 1947. And so this is very, very brave of the Tories.
NHS takes centre stage again?
Yeah, absolutely it does, because it is more than the NHS. It's loved by all of us. You know, most of us were born there, apart from most of the Tory party probably weren't. They probably at the Portland or somewhere else. But, you know, a lot of us die there. And,
we were born there.
Were you born on the NHS? I was born on the NHS.
It's a pretty irrational love, I think. I mean, if you compare its outcomes with most systems around the world, including many in Europe, I don't quite know why we're so in love with it.
No, but that's why it's so unique.
One of David
All right,
Cameron's...
we have to move on, I'm afraid. Michael was invented there.
Yes, I can see.
Now, thank you, Fiona.